7:51 all month long. We're thinking pink here on SouthFlorida.com Live. We're talking about the latest developments in the fight against cancer and the most important thing you can do to detect it early. So that's the key here, and here to talk about it, about mammograms and early detection, we've got Dr. Silberman from Baptist Health. Good morning, doctor.
Good morning, kids. How are you?
Wonderful.
Kids, wow.
You said kids. All right, doctor. So really, when it comes to breast cancer awareness, timing is everything. That's one thing you mentioned when I spoke to you yesterday. Talk about that.
About timing?
Timing, early detection, correct?
We know that breast cancer will kill many, many women, 40,000 or so in this country this year. It is important that women go in each year for a mammogram. It is important that women examine their breasts. If we can pick up breast cancer early, you can cure a woman. You can save her life. And that's the name of the game. Early detection, cure, happy day.
I know a lot of women are concerned about radiation exposure during a mammogram. Can you speak to that?
I can. And I can give you the long and the short answer, but I think the short answer would be better here. You do get a dose of radiation. You get a dose of radiation when you walk outside. Recently, a patient has asked me that question, and I looked it up, and it's felt that your total body dose from one mammogram is comparable to you walking around outside for maybe 3 months. So do you get a dose? Yes. Is it a dose that's going to affect your life adversely? Almost certainly not. And is it something that you should do that may save your life? Yes. So well worth it, I think.
And doctor, when it comes to radiation, there are certain factors. For example, if you have breast implants, you're exposed to more radiation, correct?
You're right. You've done your homework. You've done your homework.
Well, I remember our conversation that we had yesterday.
Yeah.
So.
When a woman has breast implants, it typically requires us to do twice the number of views. You have to do a view with the implant in place and with the implant pushed backward so that you can see the breast in front of it. So just by its very nature, you're going to double up on the number of images, and there's a breast implant.
I know that you had mentioned that you actually did this yourself, right? Just so you can feel what it feels like to have the mammogram. Talk about that.
You have done your homework, yes.
That shocked people, actually. I remember people in the control room were like, what? He had a mammogram himself?
You know, look, the bottom line is I've been doing this a long time. Women have said to me many, many times, Doc, you have no concept of what this is like. So about 2 weeks ago, I decided that it was time for me to get a concept of what this was like. I asked my mammogram tech, let's do it. She smiled and said, really? And so I went through a mammogram. Yes, I did. And I can tell you that it can be considered a bit uncomfortable, but it's not horrible. It's well worth it. It's well worth it. It's not a horrible procedure.
Dr. Silberman, let's talk about technology, because at Baptist Health, I mean, with the latest advancements in technologies as far as mammography goes, digital is what you work with right now, right? Can you talk about the difference between digital and what it's like at some other places or what you used to work with?
In the past, when throughout my training, we didn't have computers and we had films. We would take a film just like you took a picture in your camera, develop it, take a look at it. Now that we have computers, we can help women much more because we can take that image that is produced and we can post-process it just like you can on your computers at home. And so we can see places in the breast that were obscured before, that we just could not see. So not only have computers made it faster, made the radiation dose less, it's improved the diagnosis, the detection, the early detection of breast cancer.
Doctor, just going through the technology with you this week at Baptist Health was just, it blew me away. So thank you very much for being here this morning and talking about this very, very important issue. Thank you.
Thank you for inviting me.
And to learn more about mammograms and really the push to find a cure, we have so many links for you. Visit southflorida.com/pink. And coming up at 8 o'clock, ways to feel fabulous and donate to the cure at the very same time.